Hello, my name is Gabor. I am the co-founder and CEO of iPASy Technologies. Almost 15 years ago, I was doing research on the neural network research and applied that technology for different fields. At that time, no one called it AI. Right now, it's so trendy. But since that time, I have found a very much demanding problem. This is prostate cancer. Prostate cancer is the second most frequently diagnosed cancer among men. However, the good news is that prostate cancer is curable, but the problem in that field is that there is no currently reliable method for prostate cancer diagnosis. So this is what my company is trying to solve. Again, the problem is that the current prostate screening methods are not enough accurate, very unpleasant, and not profitable for the insurance system. We, together with my co-founders, we have developed a new method which is 6 times more accurate than everything else on the market, as well as very much more convenient for the patients because it's based on urine sample analysis. And as an extra, thanks to our method, prostate cancer screening could be profitable for the insurance companies. It's a demanding problem. Just thinking on Joe Biden's story. He got diagnosed with prostate cancer recently, but in a late phase. If someone has access to the best of the technologies, he was the guy, but albeit that one, he was diagnosed lately. It's showing, at least in my understanding, this is a very, very demanding problem. As an important problem, of course, there are competitors on the market. But if we are talking about selectivity and invasivity of those methods, iPASy is the best technology. So, summarizing, there is a demanding problem. There are others on the field who are trying to solve the problem, and there is a huge market where we can sell our method. Who is interested? Actually, all men above 50 or 45 if someone has a history in their family. Just in the European Union, iPASy has potential to reach more than 30 million euros revenue annually. How we can reach that market? We have a business model taking into account the revenue streams, how we can sell and who to sell the method. On the first stage, we will sell it to private clinics because those are gonna be the early adopters. Next to that one, we are also ready to sell the method for individual patients, as well as when the method is going to be eligible for the governmental health insurance system, then we will sell it to governmental hospitals in a very much larger volume than before. As well as we are planned to sell the iPASy method as a kit. This diagnostic kit can be sold to medical laboratories like SYNLAB, who also would like to offer our method. So this is the business model. We have a pretty good team behind this who will make this real, not just the plan. We have a world-class scientist called András Gutmann professor. We have experienced young engineers who has experience in the industry. We have a person who is responsible for financial and administrative aspects of the company, as well as we have young engineers who are working in the laboratory currently to finalize the method. Our history is going back to 2023, where we established the company. Since that time, we got close to €500,000 investment from the company called Creative Accelerator. With that help, we were able to start the clinical trialing of the method with 2 German companies, and right now we are proceeding with the clinical trial and regulatory of the method, and we will get the CE mark at the end of 2026. Based on our current plan, we will launch the market at the beginning of 2027. To protect our process, we have a pretty good IP portfolio. We have a granted patent in the European Union, as well as we have the patent pending status in Canada, Japan, and the United States. We have a plan where we can reach the market, and again, iPASy has a huge potential to reach more than 30 million euro annual revenue only inside the European Union. But do not forget, we also would like to go to the European Union. Right now, we are raising for 1.1 million euro to finalize the clinical trialing of the method and establish a laboratory which can be offered right after we got the certificate, the CE certificate, the laboratory which can sell the iPASy technology. And as we have learned from the Wigit dice, one more thing which is very, very important. If you consider iPASy on the socio-economic level, iPASy has a huge potential to be able to make the prostate cancer screening profitable for the whole society. Translating it to the language of figures, on one man, we have the chance to save cost up to 50,000 euro if you taking into account all of the elements of the prostate cancer diagnosis and treatment pipeline. And this is one of the most important. If you find it promising, join us and co-invest to iPASy Technologies.